everyone, my name is Sydney Gladding. I'll be doing a medical case study. Our patient's name was Winter. She was a 3-year-old intact female American bully who presented today for chronic ear infections. She is on Diamond Naturals chicken and rice. She was up to date on her vaccines, was currently not taking any medications, and had no previous medication or vaccine reactions. After talking with the owners, Winter has had chronic ear infections in the past. The medications that we had prescribed in January really helped, but the ears flared up again about a month ago. Owners also had noted that Winter had not been eating well the last 3 days, which is unusual for her. They had also noticed that she is urinating on herself during the night. Her last heat cycle was 3 weeks ago. On physical exam, she was bright, alert, and responsive. She had a body condition score of 6 out of 9. Her left ear was statonic and her right ear was inflamed, but both had moderate debris. She had a right systolic heart murmur, which was a grade 2 out of 6. And owners reported urinary accidents at night, but the bladder had palpated normally. Her heart rate was 120, her respiration rate was 48. She had a temp of 103, and her weight was 58 pounds. With some of her symptoms going on, the doctor had recommended doing some blood work, which was approved by the owners, and it included a full CBC and chemistry panel, which had showed everything within normal limits. An ultrasound was performed, and it had found a fluid-filled uterus. And as you can see here, you can see one of the uterine horns, and then you can see the other, and then how they both had fluid inside of them. So Miss Winter was diagnosed with a pyometra. And then we also ran an ear cytology, which was looked at under the microscope, and it found TNTC cocci, 30 rods, and 2 to 5 yeast in the left ear, and 10 to 20 cocci, 5 rods, and 1 to 3 yeast in the right ear. So what is a pyometra? Pyometra is an infection of the uterus that can occur in any intact female, dog, and cat. The true cause of this disease is unknown, but spaying the patient will stop the disease from happening. Pyometra will affect roughly 1 in 4 non-spayed females before the age of 10. The most common symptoms include lethargy, depression, anorexia, excessive drinking and urinating, and vaginal discharge. The owners had approved surgery, and our pre-anesthetic protocol included acepromazine and buprenorphine, which were both given intramuscularly. And then our induction agent was propofol, which was given IV, and Winter was intubated with a 9 endotracheal tube. Treatment for a pyometra would be a surgical ovariohysterectomy to remove the fluid-filled uterus. This operation removes the 2 ovaries, the uterine horns, and the body of the uterus. The patient is surgically prepped using chlorhexidine and alcohol and placed in dorsal recumbency on the surgical table. This is prepared just the same as any normal spay. And then a canine ovariohysterectomy surgical pack can be used to remove the pus-filled uterus. As you can see in this picture, this is a pyometra uterus, so all this is filled with fluid and pus and infection material, where a normal uterus would be much smaller than this. The actual surgery itself included a ventral midline incision, and the uterus and ovaries were retracted. The uterus appeared to be distended, warm to the touch, and fluid-filled. The ovarian pedicles were crushed and clamped and then ligated with 2-aught monocryl suture and transected. The uterine body was clamped and ligated with 2-aught monocryl suture and transected. The uterine body arteries were ligated separately, and the entire uterus was removed. So Winter had recovered well, and she was kept for the remainder of the day and then sent home to recover with the owners. The patient was sent home with vetprofen for pain control and cephalexin for an antibiotic. The prognosis for pyometra with an ovariohysterectomy is between 80 and 100%. Owners were made aware of urgent care hours until 11 p.m. that night for any concerns or complications, and a callback was set for the next morning to ensure that Winter was still doing well. Written discharge instructions were sent home with the owners, which included exercise and activity restrictions, incision care, diet restrictions, and medications sent home. It also included a signs to look out for an infection of the incision, kind of not eating, all the signs that we want to know about to make sure that she's staying healthy.